What's up, YouTube? This Jay. Just wanted to update you guys on what's up with me for the day. Yeah, y'all know today was T Day. So I thought. But unfortunately for me, I have one of them doctors who is just kind of clueless. Dr. Fish is my prescribing doctor. But Dr. Fish was not going to be available. So I chose to see a different doctor. Dr. Smith, nice, gorgeous black woman who is actually my age and clueless about hormone replacement therapy. So she got my baseline in. Baseline was lower than normal for me. And I was really surprised to see that it was as low as it was, but due to the fact that a cycle popped up again on me, which would have been my normal cycle, just came down a day ago. It's just like, can't win for losing. So today for my appointment, me and her just kind of covered the bases. She wasn't too sure on how she was going to prescribe the testosterone for me. They don't carry it in the office because it's an OBGYN clinic. But she did say she was going to trust me to pick up the prescription once it's called in and bring it back to them for my appointment to do my first injection. That's what she said. But I really got a feeling that what she's going to do is she's going to order it, have my insurance cover it, and have it shipped to her so she can make sure that it comes into her first and she can supervise the injection. I am a certified medical assistant. I do know how to deliver intramuscular injections. I did let her know that, but she is just not on it. So what's going on? My blood work was in for a baseline. As you know, I gave her all the blood work that I had from my primary doc, which covered all the bases. She was like, cool, everything looks normal. My blood pressure for some reason was high, but I'm thinking it was some serious anxiety and the fact that I ate sausage before I went to my appointment without filtering it with water. So a few things play a part. Now, we talked about me taking the DHEA. Apparently, even though I did try the 100 and didn't feel too good, apparently it's what I really did need. After that first week, the DHEA kicked in. It gave me what it was going to give me for that moment with the 50, which deepened my voice. I grew my hearing really quick, and my cycle did alleviate that month. Now, she told me because the liver filters that pill and because it was such a small dose, what I needed was actually to have upped it, and I would have saw the things that I was looking for, which means I would have never got another cycle. But you guys do know I stopped taking DHEA the other day, so I haven't had a dose in 2 days because I wanted to have my system kind of trying to work on its own because of the testosterone. Come to find out, it wouldn't have made a difference because even if I would have took the DHEA at the dose that I've been taking it wouldn't have really done much. So, hey, I found something new today. Next, like I said, she didn't know my dosages. She was saying that she wanted to call my insurance and call the pharmacy, see if they can kind of help her with how she'll properly dose me, which was crazy because she's the physician. But I basically broke down to her the lowest and highest dose that I should be taking based on the knowledge that I've gained from my fellow Ftm brothers and from my own research. Now, she did go ahead and leave me in the room for a little bit, me and my girl, and just kind of do a little digging or whatnot, and find out that she do want to start me on a 100 milligram dose. And I explained to her that fine and dandy, but to me, I would like to start off as low as I can because it is the shot, and I am older and I have anxiety issues, and I don't want to put my family through any extra anger or depression that may arise from too much medication. So I did ask her to let me take that dose broken up into weekly dosages. In other words, 50 milligrams every week is what I want to do. she kind of didn't understand, kind of battled with me a little bit, and I battled with her and I battled with her. But I mean, once the testosterone was in, I'll re-explain to her what I was actually wanting, and we can go from there. Now, I did have an endocrinologist in mind. She actually knows her personally, so I suggested that she give her a call. All of her phone numbers were available to her that I wrote down personally, because I made a list for her, and I just want her to give her a call and see if she can take me as a new patient, because endocrinologists, as we know, are more familiar with hormone replacement therapy as well as things that has to do with the blood and the chemistry of the body. So I wanted the endocrinologist to be my continuing providing physician. That way I can get in and see her, and she can do the blood work that she needs to do and just monitor me a little bit closer. Now, we talked about hysterectomy and cycles. She did not recommend me getting a hysterectomy because she said it's important for the calcium basically in the bone, for the bones to stay strong. And I get it. I've already did that research, and I was saying, well, we can cross that line in a couple of years. She's wanting me to put that off. But she offered a procedure to actually burn, cauterize the inside of my uterus so that I can no longer get a cycle. She said it's 99% that my cycles will stop sooner than what I would want. I mean, sooner than they would with the testosterone. And I was considering it, but after thought, I just said, I mean, if I want to go into messing with my inner parts, I might as well get them taken out, you know. So I'm like, I don't want her to just have me do this procedure just to give me 2 months earlier of a non-existent period. I would rather just deal with the fact that the testosterone has to run its course, and then my cycle will eventually stop. My biggest thing is future. What's going to go on in the future? What should I do for my future? But we'll cover it later. So we talked about that. Now, how long is it going to take me to get this script? The only main thing she had to do is just kind of talk it out with the pharmacist. Order the script, let me pick it up, and bring it into her office. But I have to have an appointment. This is how they played me. I have to wait till next Monday, for my next appointment, which is stupid. So what I'm thinking in my head is what I said before. She's going to actually have them send it to her. But she did send a message to me and let me know that if she gets this done sooner than later, that we'll just up the appointment and I'll come in sooner. So I'm hoping by the end of the day today she'll have this taken care of, and my script it'll be called into the pharmacy and ready for pickup, and I'll just come into her office. So we'll see just how far her trust goes, because she did say she trusts me to do the right thing. So we'll see. Now, another thing, she claimed that she wanted me to let the doctors work for me. All fine and dandy, but to me it seemed that after all of my research I knew so much more than the docs. So I just wanted to say that to my fellow brothers, be an advocate for yourself, do as much homework as you can, don't take what they say as the last thought, do what you feel that's in your heart, push the issue, be an advocate for yourself, because if you sit back and listen to what they say and leave it as that, you never know what can happen, or you never know what could have happened, you know? So I'm just like, look, I told her, I'm letting you guys work for me, but I want you to really work for me. So I've been doing all the monitoring. I've made so many phone calls, my insurance and everything. I've done that too, and even did the research for my mastectomy. Now, when it comes to my mastectomy, she said because she's not a surgeon, she thinks that my surgeon should be the one to issue that medical statement to my insurance. Okay, I heard her out, but I do know as a physician she has the ability to look and assess and give her own opinion. She just wanted to wash her hands with it. That's all good. I'm cool with it. I'm going to go to my physician who was surgeon who actually did my surgery when he did my breast reduction, and see if he'll push the issue about my mastectomy and get it covered. I don't want him to do the surgery. I actually want Dr. Medali to do it in Cleveland, Ohio, where I'm from, because he's a really good surgeon and he specializes in it. Dr. Peterson did my original breast reduction, and my left breast is off because of it. I mean, not off literally, but it's over to the middle instead of over to the left. So I don't want him to cut on me again. I may stick with their office if the other surgeon that works there agrees to do the surgery. Now, okay, what's next? So we covered surgery. Oh, my name change form. Took that into her. She said, "Well, I'm going to sign it, but I'm going to just keep it here." Stupid. All she had to do was just put her name on the end of the paper, because I already did my basic part. She took the time to write my name in it. She could have took the time to sign it, but for some reason she didn't. What I'm thinking is she just want to make sure. So it tells you how clueless Akron, Ohio is on FTM transitioning, and I figured it would be like that because nobody really specializes in it. However, Dr. Fish, who is my prescribing physician, who I haven't seen just yet, who actually runs the clinic, does it on a day-to-day basis in his own private practice. So I'm hoping she gets smart and decides to give him a call when she doesn't understand something. But overall, she was a nice lady. She was a little combative with me, so we was combating with each other. My woman said, "You just don't have no patience." She understood her, but me, I just felt like she was kind of clueless and she wasn't hearing me. But what it boils down to is I gotta wait a little bit for my my testosterone prescription. She said she was gonna try to get to that by the end of the day today. I'm like, okay. So hopefully she'll get it done and they'll give me a call and I can get in, say tomorrow or whenever she's back in the office. And I'll just get it up there if that's what she's gonna let me do. So, more waiting. As usual, always a time to wait. Always. So what I'm about to do in the meantime, I'm about to turn up. Yes, because I'm pissed off. I'm upset. I'm really aggravated. I saved like that much liquor in my liquor bottle that I'm going to just turn up after I eat because I'm pissed off. And I don't recommend drinking your problems away because they don't. I'm just taking advantage of the fact that I'm not starting tea today and I just want to be a little bit more at ease. The only thing is it'll affect my blood pressure because alcohol affects the blood pressure, so drinking isn't good. But I'm just going to take me a small drink just for right now, just so I can just kind of get in chill mode and just calm my nerves because I don't smoke and I don't smoke cigarettes and I don't take anything for anxiety and I just want to calm down a little bit. So that's what's going to be my alternative for today. For future references, I'll find other ways to calm my nerves. Good sex. Yeah, I might try. I'm going to do that too later. So that's going to be part of my calm down. But normally it's the weights. It's too cold. I don't feel like it because I'm cramping and I feel like crap and I'm bleeding really heavy that just hit me. So I know that's TMI, but that's what's up. So I'm not going anywhere out the door today. I'm in the house. So, yeah, that's what's going on. T-Day postponed to later on this week. I gotta be cool with it, but it's all good. I just gotta try to be a little bit more patient. Don't have much patience, but hey, like I told her, look, I waited 36 years. I'm not getting younger. I don't want to wait any longer. I want this to happen. This needs to happen. So I just wanted to let y'all guys know that's what's up. So I'll talk to y'all soon. Peace out.